Hey guys, and welcome to episode 13 of the Revive Yourself podcast.
Are you sick and tired of being sick and tired? Have you got a health issue that just won't go away no matter what you try? Then welcome to the Revive Yourself podcast, where we reveal the secrets to long-lasting health by getting to the root cause of problems that no one else is talking about. So you can have more energy, clear skin, healthier hair, a leaner physique, more confidence, and most importantly, do the things you love and live the life you deserve. Here's your host, Ryan Martin.
Hey guys, and welcome to episode 13 of the Revive Yourself with Ryan Martin podcast. Last week's episode with Terry Tillard was a classic, and we've been getting loads of messages through on that one. So, I know that it really did open people's eyes to a lot of things they didn't know about, which is brilliant. This was what we all want, and hopefully it's given the power back to you and the confidence that your health does actually lie in your hands, which is exactly what we want. And today's guest, Dr. Jessica Peatross, is it's going to be another inspiring story. Dr. Jessica, I was going to say Dr. Jessica. Jessica she is an MD, and she did complete her medical practicing and medical exams, and she was a doctor for a long time in the medical setup. But she got ill and went through her own problems, and it led to her now treating people holistically, treating people with the Gerson Therapy, amongst other things. So we're not going to go too much into it. I want to get straight into the interview with Jessica herself. So without further ado, guys, here she is, and I'll see you on the other side. Here we are. Welcome to another episode of Revive Yourself. Today's guest is Dr. Jessica Peatross, all the way from Portland in the USA. I've been really keen to get Jessica on the show. I've actually been back and forth with her for about I think it was actually before Christmas.
I think so, Ryan. Yeah, I apologize.
That's all right. No, it's okay, because the reason I wanted to get Jessica on was because she's got a very, very interesting story. And it's a story that a lot of more and more, I'd say, probably doctors are taking, but some because of financial reasons, probably, and maybe just being scared to do it, they don't do it, even though their eyes are being opened. So, welcome, Jessica, to the show.
Thank you so much.
That's all right. How are you feeling today?
I feel great. Thanks for having me on.
No worries. So, Jess, I'll say Jessica. Jess, Jessica actually has got an MD in internal medicine, and she's actually gone from that into being a holistic doctor. So, you had your medical school. It was in Kentucky. Is that correct?
That's correct, at the University of Louisville. Yes.
Yeah. And then you did your internal medicine residency. And you said you did a lot of work for Big Pharma and research studies in Big Pharma. What was that like?
Yes. Well, it's kind of built into a lot of residency programs. They have you do a lot of research projects prior to graduation and things like that. And I was fully sold on the pharmaceutical side of things. I mean, for 7 years, I was a hospitalist in the hospital, which means that right after internal medicine residency, you go straight into a 7-day on, 7-day off type of work setup, and you admit anything from the emergency department that doesn't require surgery. So I was well versed in a lot of very serious, a multitude of different disease states and conditions. And all that we were taught throughout medical school residency and then into the hospital world was how to use pharmaceuticals. So I still can tell you anything you didn't need to know about pharmaceuticals, but what I saw from the hospital, my hospital story was not exactly what I signed up for when I went to try and go heal people.
Yeah. And what year was it that you actually started to work in hospital?
It was 2009.
2009,
yes.
Okay. And because in your videos, so Jessica has a website. You've actually got two, but your main one is for yourself. I was just on it a minute ago. Jessica, what is it? Dr. Jess, is that right? .com?
Yes,
yeah.
Yes. That's my Yes, that's my alter ego. Yes.
Yes, your alter ego. That's fine. No, because I was watching a few Jessica's videos, and if you guys go and should take a look at her website and look at the videos she does. She's got quite a good following on YouTube as well. She's got a good YouTube channel. But in one of the videos, you said, quote unquote, to sort of like paraphrase you, although the system, this is talking about the medical system here, although the system is respected, there are a lot of mistakes and oversights, and money is exchanged behind closed doors. What do you mean by that?
Well, if it's not the public is not privy to this exchange of money, and even doctors mostly are not. You really have to dig behind the scenes to see the conflicts of interest. And one of the things that hit me the most was that the medical schools get paid by the pharmaceutical companies forever to teach a certain curriculum. And this is there are hints of this shown throughout medical school if the students and the residents are keen to look for these things. For example, my internal medicine board review book written by Harrison, which is one of the most famous board review books for internal medicine, was written by Bayer Pharmacy. I mean, they helped edit and write it. It's their stamp of approval is on the first page when you open the book up. And wow. Not just that, but, British Medical Journal, JAMA, all those different famous journals have money exchanged from big pharmaceuticals behind the scenes. And it wasn't too long ago that those same journals had tobacco companies and agricultural companies paying for ads. So they're all in bed with each other. It's very intertwined. It's very covert and behind the scenes. So someone really has to kind of be searching for it or know about it, or they can really have the wool pulled over their eyes. You really can. Yeah,
I mean, that what you just said there, I don't think many people actually realise that. That really is the fox guarding the hen house, really, because if you've got a pharmaceutical company writing your internal medicine book that you're going to study, wouldn't it just suggest that everything they're going to tell you to do would be in their interest?
Absolutely. I mean, I'm sure you can guess what most of the correct answers, quote unquote, were with those board review questions. And they were pharmaceutical drugs before anything else, which is always what we've been taught is superior to anything else.
Yeah. And for someone looking, I mean, this is why people always say, well, these studies show, and it could be any topic, and a study comes up and people say, well, I've read this latest study, and I always say, well, who performed the study, and who was it
exactly.
funded, and who is it funded by? And sometimes people go, "Oh, you're one of them, you're a quack." I'm like, no, I'm being serious. If a pharmaceutical company's paying for the study, what results do they want? I mean, they want the results that's going to make them the most money, correct?
Exactly. And then we just have another story break just this past week about how supposedly the EPA colluded with Monsanto to say that their Roundup did not cause cancer. So, I mean, you have the head of the FDA, Michael Taylor, who also worked for Monsanto. So, I mean, there's just blatant conflicts of interest throughout the healthcare pharmaceutical world. And, when they do the studies, they say, oh, this drug is, work this way and cured, or you're fixed this, whatever they say. But, what other options are there? Are we investigating all the other options? That's my question.
Yeah, I mean, obviously you are now, and we are. It usually takes. I'd say. I'll just couple more points on it, just because before we go into that, because like myself, you actually went through your own health issues. Actually, you said needed your eyes ripping open. But that's generally what it takes people to get into this world, unless they've got probably a family member in it. It usually takes someone going through a whole host of health issues and then going down the traditional route, which I did. You probably did as well, and then it not actually working, and you're looking for other things. But you said back in when you were working, but we'll probably go into this story. But you said when you were working in hospital, you were helping people. But you say you were helping people in quotes, but they kept coming back once you discharged them. And surely doesn't that give people sort of like an insight into these things aren't working?
It should, and I think it's starting to. But back when I was sort of head fast in hospitalist work, I think most of us were kind of blind to other options, or weren't open to it. I'm not sure, but the paradigm is definitely changing. It's called hospital bounce backs. And now the hospitals and insurance companies are actually starting to ding, the insurance companies are starting to ding the hospitals if they have, for example, a congestive heart failure patient bounce back in 30 days, which is insane in itself because the patient could go home and eat a salty meal and put themselves into heart failure. It's not necessarily the responsibility of the doctor or the hospital to prevent a bounce back. But now you have all these patients coming back to the hospital to be readmitted. And this should be a clue that the medications are a Band-Aid that cause other problems for which then you need to be treated, which costs a lot of money and makes money for the system.
Yeah, 100%. And if you're in that world of being a doctor, I think you mentioned you go through a lot of practices that are sort of programming where you're very sleep deprived, you work very long hours, and you're almost taught, you said, to step on each other to try and get to the top marks. I mean, to get to the best positions, and then almost look down at anything that's not medical. Can you just talk about that a little bit for us?
Yes, absolutely. It's a dog eat dog world, very much so. I mean, we called these medical students and residents that were kind of would suck up to the teachers and really stay up and want to be the best. We called them gunners, that were gunning for number one. And it's very stressful and competitive. I mean, they really breed competition, as I think everyone would probably guess. So yeah, it's difficult, when you're sleep deprived, you're stressed to see anything outside the box that you're stuck in that world. So absolutely. I think that, for me, especially, I definitely had adrenal fatigue, and, it was hard for me to continue all the way through residency, actually, because I became so sick, in the last year. So really for me, I think you have to kind of hit rock bottom to be able to wake up and see, what other options there are out there.
Yeah, I know. Yeah, I mean, just anyone who's ever watched. I think it was my mum used to be massively into Grey's Anatomy, and I remember watching a few episodes of that. And I think it was very much like that on that show, where everyone was just trying to do whatever they could to get ahead, rather than, it was very much self first rather than patient first. If that makes any sort of sense, yeah.
Yeah, the system is very sick. It's not about healing. I mean, when you walk in a hospital, these gray walls and people hold you down and stick needles in you. They force you to stay beyond your will. They give you food that really is sick food the whole time you're admitted. It's just it is the opposite of what you would want as a healing entity. When the nurses don't even have time to go to the restroom on their 12-hour shift, that lets you know that we're mistreating people and patients.
Yeah, it's every time you think of a hospital, I think most people don't like it because it's quite. If you think about it, it seems quite cold, quite a. Yeah, it's just like there's nothing there that would be like even healing. If you're telling someone to heal, you think of like a beach, right? Somewhere hot and warm and tropical, fresh air,
right.
Great food,
right.
And the hospital, I'd say, is the complete opposite of all those things. And that's, I don't know, maybe you'd agree with me, but that's the sort of way I'd say if I wanted to heal, I'd go somewhere that had everything to heal, and you'd think, oh, go and get some bed rest, or go and heal in the sun.
More like a spa.
Yeah,
everyone wants to go to a spa, right?
Right, nice energy.
That is, yes, absolutely. In a lot of Eastern cultures and in medicine, that is the type of healing that they promote. So we just don't take into account in Western countries that mind, body, spirit are connected, although there are just a blatant disease states that show that they are. So that's part of the problem with the hospital. It's just for physical healing only.
Yeah, and it is. Yeah, I know. And from my experience of going through, I know I went through my own awakening in about 2008, 2009, and yours happened in 2012. Can you just tell us what happened there?
Yeah, absolutely. It's kind of a little bit of a crazy story, actually. So I was, back at that time, I was making pretty good money as a hospitalist. I was hadn't been married that long, and really thought, this is it. I drive this kind of car. I live on this same block with the mayor. I have the biggest pool on the block. I was very focused on selfish, egotistical things. And I wasn't well. I was trying to work out every evening on very little sleep, continuing adrenal fatigue. And something weird happened. I started to get anger issues and reactivity issues. I started to have jealousy issues. I started to really have horrible anxiety to the point of almost panic attacks. And it was my liver being overwhelmed and adrenal fatigue on top of that. And I went through a pretty nasty divorce after not being married very long. And I call it my fall from grace. It's in a town like Louisville where most of the people. It was big news. And so at that point in time, I had restless leg syndrome. I was up all night, waking up, had headaches, all that kind of stuff. And I was almost suicidal whenever I went through my divorce. I really thought, that's it. I cared what everyone thought at that point in time. And I was really close to contemplating this. And I don't know what happened, but something changed my perspective. And it was sort of the way I look at it now is you have to be cracked open because that's where the light enters. It's a quote by Rumi. And it was very much true for me. And when I hit rock bottom, and still made it, here I was, all still living and everything after my fall. It wasn't as bad as I thought. And then I thought, what got me in this position? And then I started having to backtrack and rewind and see how some of my decisions and thought patterns and actions had gotten me where I was. And that I couldn't really blame anyone else anymore. And at that point in time, I started looking into herbs. I started looking into, actually taking care of myself, being self-loving, and having some actual self-care every day. And so, it took me a while to step out of the hospital at first because, that was really, when you step out of the hospital world as a medical doctor and you go holistic, you're cutting your salary in probably a third. And so, maybe actually more. So, I went to a fraction in making of what I was making once I left the hospital, which was fine because I was finally happy, and it changed who I was as a person. It changed what I thought of health. It changed what I thought of myself. It changed how I treated other people. And I really saw the error in my ways. For many years, I had done that, and acted out of turn. And so, now, I went and got some extra training. I went and did Gerson Therapy training. I got trained in ozone. I got trained in applied kinesiology. And I still try and learn every day. And that's when I started writing, which is my true passion. And it was kind of like my awakening was pretty violent and pretty abrupt. But I changed overnight. It was almost like I should have changed my name. And now I have all this extra training, and I love what I do. And I don't ignore what my heart wants anymore, which I was doing before for a long time just to keep up pretenses and appearances. So
yeah, I can. It sounds almost like you. From the outside, everything looked rosy, but on the inside, it was all falling apart.
Absolutely.
Yeah. And that's what a lot of people you've ticked all the boxes, you've gone through medical school, you earn good money, you're living on the same road as a mayor, it all looks good, but inside, the doctor who's meant to be telling people have to be healthy was falling apart. And that's a story that I've heard countless times from lots of doctors having worked with them. It's awesome that that you could listen to yourself and actually go down a different route rather than being stubborn and just hitting your head against the wall for years.
Yeah, it's, I watch a lot of docs do that and be miserable most of their life. And they are the exact opposite of the epitome of health, bariatric surgeons who are 400 pounds. And so we're all just a little bit hypocritical in that field. Yeah. In my opinion.
I mean, doctor actually comes from the word teacher. And I always say to people I've seen, I said, well, what are they teaching you? Oh, nothing. They just gave me exactly. And that's the truth. I mean, in most cases, you go and see a doctor, they don't teach you much. But when you work with someone like yourself at the moment, or any health coaches out there, it's like what you're trying to do. You're trying to liberate people by giving them education into health and listening to their body. And it's great that for someone like yourself who's gone through that journey, it's awesome that people can listen to someone who's got the knowledge of both sides of the fence, because it gives them, because a lot of time they sort of feel that there's alternative or holistic world, and then there's the conventional world, and they're sort of against each other. Oh, and they're always going to say, "Oh, one side's going to say this, one side's going to say that." But for someone who's been on both sides and has seen it both, it's I think it's a very powerful story. And so you mentioned it's about 2012, and you went and you did Gerson Therapy as well as other things. So I think you did emotional freedom technique. Is that correct?
Yes.
Yeah. So just for people out there who are not familiar with the Gerson Therapy, what is Gerson Therapy and what's it like? Who can it help? And what's it do?
So Gerson Therapy is it's a therapy, not a lifestyle. However, in my opinion, it could be somewhat incorporated into a lifestyle as well. So the premise is juicing, coffee enemas, and certain natural supplements to help treat cancer or autoimmune conditions. So any sort of chronic condition can be treated by Gerson because obviously juicing is not a bad thing for anyone, in my opinion. So it's wonderful because there's so many case studies that we have, and I met doctors from around the world who believed like I did. It really ripped my eyes wide open to see that there were other options that were being hidden in plain sight, actually. So I actually just finished up a Gerson patient last night, and it's a beautiful thing to watch these patients transform their lives just by food and hard work and natural supplements like certain mushrooms or digestive enzymes and probiotics. So really, it's an intensive therapy to help treat any sort of chronic condition. However, anyone can do it just to improve their life and health.
Okay, and it concentrates mainly on you said juicing, enemas,
coffee enemas, yes.
Enemas, and what was the third one?
Just certain natural supplements.
Okay.
To help rev up immunity and things like that.
Okay, and how long generally? So you deal with people who've got all different sorts of diseases, but how long in general does the therapy last, or how is it just as long as it takes?
Well, the standard care for someone who has cancer is a 2-year therapy. That's pretty intensive. And so, the aggressive therapy where they're at the tip top doing Gerson all day long is 13 juices a day.
Cool.
And these are a green juice, a carrot apple, and a carrot juice. And those are just about, obviously every hour you're awake. And then, the highest coffee enemas we do is 4 to 5 coffee enemas with 13 juices. So that's the very aggressive therapy. We have some people on 4 juices who are very elderly, and that would last a couple years. And then they would get bumped down to a maintenance dose of Gerson for the next year after that.
Okay, so a green juice. I mean, most people know the benefits of having lots of different greens in as a juice, cleansing, detoxifying, probably also chelating, etc. But people would say, well, carrot and apple juice and carrot juice. I mean, I know, but people would say that they're full of sugar, right? Wouldn't that be too bad for you?
No, the difference is that this is all natural vegetable or fruit sugar. And we actually, to avoid the sugar in apples, which are normal red apples, we really recommend Granny Smith, who have some different antioxidants in them. And the green apples are obviously much more tart. So apples benefit in general as they have pectin in them and some other antioxidants that can help bile move and absorb gallstones. So anybody who has cancer or a chronic condition usually has a compromised or sluggish liver. So that's one of the areas we're hitting with the green apples. The carrots, they do have some natural sugar in them, but it's only sugar from juices. The rest of the Gerson therapy really promotes plant-based, vegan diet.
Okay.
So, it's not like any sort of processed sugar.
Yeah. Okay. And people are getting all the nutrients they need from these. Do you use anything else to stimulate liver? Things like milk thistle, maybe sarsaparilla, anything like that? Yeah.
Yes, absolutely. We have a whole list of Gerson supplements that include anything from a natural thyroid supplement to rev up metabolism while we're putting in juices and detoxing enemas, to move the cancerous cells out, to we have digestive enzymes, to milk thistle, to turkey tail mushroom, which helps fight cancer. So there is a whole list of Gerson supplements that we can incorporate into this regimen.
Oh, awesome. And it's a holistic therapy based on juicing and whole foods. And you also use applied muscle testing and neuroemotional training. Was that all part of the therapy?
No, it's not actually. I went and did that separately on my own.
Okay.
But it does help sometimes when you've got kind of a issue that you have an idea about, you're not sure. If you can actually physically see the patient in person to muscle test them, that can be of great benefit if there's a question that you're not sure of. The issue with Gerson is it's all via telecommunications now. Mm-hmm. So it's all via Zoom or Skype. So I don't have the luxury usually of seeing the patient to muscle test them.
Right, okay. So what is this for people out there? What is a muscle test?
Right. So applied kinesiology or muscle testing or a neuroemotional technique is a very rigorous, actually, training that we go through that shows how you can elicit the truth from the body that's not in the consciousness yet. And I explain this to people by saying, your body has an intelligence that you don't know about. You don't realize when insulin is being released from your cells to help take blood sugar into the cells. You don't realize if there's a tumor in your body. If a computer had this problem, we'd say it had a virus. Mm-hmm. So, there's something that your body knows that you don't. So we can actually muscle test the body by posing not questions, but statements to the body about any sort of hidden emotions, any sort of pain in the body. And then a well-trained practitioner can see when they can't hold their arm up against pressure, that they are not telling the truth to themselves. And there's actually some studies.
Does anyone about to say, does anyone come to you and say, this is just quack stuff, this is woo-woo?
Oh, yeah, absolutely. You're a medical doctor and you're acting like this. What are you doing? Absolutely. People say this to me. Be careful with using your platform in the right way. I hear this all the time.
Yeah.
But, the things that I've experienced myself when I went to neuroemotional training and what I've seen, and then the studies that are getting ready to be published on it that are very close, do show that there is merit to it. And there's a lot of chiropractors and naturopathic doctors already doing this throughout the United States with great success.
Mm-hmm. Yeah, I can imagine. So it comes from, is one of the tests, I think I see people do muscle testing, so it's almost frequency. I was actually reading, I don't know if you've heard of DNR site? Have you heard of the light energized solutions?
Yes, I have.
Yeah, I was reading some stuff on them today. They're actually phenomenal. Have you ever used them before?
No, I haven't. I just know about it.
Yeah. That's probably a good topic for another day, but they're phenomenal. But it's they use muscle testing, so it's almost like holding something in your hand, and if your body's weak, if you push it down, it's weak. Your body is against it. If it stays strong, it's something your body will have. Is that very simple terms of it?
Very simple, yes. And we didn't learn that yet. It's probably in the next training I'll get. But What I've learned is just hold the arm out and just state statements to the body. It can be about money or love or pain or anything. It could be about anything. And the body you really cannot hold the muscle, hold your arm up if there's any sort of lie that you're not sure of there. Yeah.
Ah, cool. So it's different. And you also, I want to get into a couple of these different things, but you're also a big proponent of ozone. Can you just tell people what this is and who it can help? In my opinion, it's absolutely phenomenal. It's one of the things that I think it even works against what's antibiotic resistant strains, if I'm correct. So to just go into about what it is and what people can use it for.
Absolutely. So ozone is O3 instead of O2. So it's 3 oxygens connected rather than 2 oxygens like what we breathe in the air. It's actually what does protect the earth, the ozone layer. So it's quite protective if it's used in the right way. And the reason it is illegal in the United States is because the medical boards say that it is a reactive oxygen species that's an irritant when breathed, which is true. You should not have ozone from an ozone generator being dispersed into the air it can cause respiratory problems. Mm-hmm. But when bubbled into a medium like olive oil, hemp oil, coconut oil, or used in the blood or used as insufflation in certain cavities in the body, it absolutely is healing. I've seen it cure Lyme disease. I've seen it treat cancer. I've seen it treat all these chronic conditions. Because what the problem is now, we have so much pollution.
As a cream or as a blood work, as in the blood?
in the blood for Lyme
Yep.
disease, and that's called major autohemotherapy, which is where we take the blood out, we inject the bag with oxygen or ozone, and you watch the blood turn from maroon to bright cherry red because it's very oxygenated now. And then we drip the blood back into the patient. And so, a lot of problems and chronic conditions now are caused by low oxygen in an anaerobic state. And so a lot of people do not have the oxygen content that they should have to fight disease. Even Otto Warburg, came out and won the Nobel Peace Prize for discovering that, no cancer can live in an oxygenated environment. So that's the basis behind ozone and hyperbaric oxygen chambers together. And so ozone also, when bubbled into, medium like olive oil, can be used as a first aid remedy to heal wounds and scabs and scars, wrinkles, eczema, psoriasis, and works very, very well in all those conditions. And then the other way to use it, which Gerson uses it, is insufflation. So we encourage Gerson patients to buy an Ozone Generator from Longevity, is who we think is very reputable company out of Canada. And they're probably anywhere from $5,000 to $8,000. What you can do is fill up an empty bag, a sterile bag with ozone, so it looks like air, and then hold it in the rectal cavity or vaginal cavity, ear cavity for 5 minutes. And the benefit of that is if you have someone with colon cancer, you're getting the ozone to the exact place where the tumor is.
So that's longevity.com, is it?
Yes.
Okay. And so, sorry, carry on. I just wanted some listeners can just know where they can look and things like that. So you hold it. You say you hold it to.
You hold it for 5 minutes, as long as you can. Of course, this is going to be air. It's a gaseous substance, so it's going to be a little harder to hold. But everyone just do their best. And if there's anyone wants to read more, there is a lot of information on Dr. Frank Schellenberger's website. Is who I trained. That's who I trained under for ozone therapy. So he's the premier medical doctor in the country that teaches classes to everyone else about ozone and has done a lot of research on it.
So one more time, Dr. Frank
Schellenberger.
Schellenberger.
Yes.
Cool.
Yeah, so that's a nice site to read up on a lot of ozone information.
Oh, awesome. And this is something that you say, Gerson promote it for. They ask their patients to get it themselves. Have you had it have you tested it yourself?
Tested what? I'm sorry.
Have you had it yourself? The
ozone? No. You know what? I've had ozone. Obviously, I've used ozonated oils because I have them on my website. I believe in them so much. But I drank ozone water. I've done rectal insufflation with ozone, but I have not done major autohemotherapy, which is where we draw the blood out and put ozone in it and put it back.
Would you? I mean, is it only for sick people, or can anyone do it for increased health?
Anyone can do it. Here's the issue: is it's a pro-oxidant, meaning there's a reactive oxygen species. It forms hydrogen peroxide, which is H2O2, and then one oxygen is left as a reactive oxygen species. Now, critics of ozone therapy will say that's a reactive oxygen, species that is a pro-oxidant, not an antioxidant. So this is the basis for not using a vitamin C IV near ozone therapy. However, nitrogen, nitric oxide is also a pro-oxidant. Nitric oxide is very important for dilating blood vessels, and we all need that. And so the balance between antioxidants and pro-oxidants is what's important. So yeah, definitely healthy people can go get this. It's not something I would recommend, twice a week though. Everything in balance. No.
So it's something you'd use maybe, I don't know, once or twice a year, or would it be more than that?
Yeah, absolutely. Absolutely. And if you're ill and with a chronic condition, or a virus like something like Lyme disease, herpes, all these different conditions, it's excellent for eradicating viruses.
Yeah, Epstein-Barr virus, bacteria. Things like that.
Oh yeah, Epstein-Barr virus, absolutely.
Yeah, people. Absolutely. I think most. I don't know. It's I think it would maybe you. I think you were talking about before. Quite a lot of people talking about it as well. As like, I think a lot of the population, especially UK and US, have got underlying viral conditions that they just don't know about.
Yes.
Yeah, especially Epstein-Barr virus. I think it's just almost an epidemic of it. So anything that can help with that. And you say it's phenomenal for Lyme's as well, which is huge.
Yes,
Yeah.
absolutely.
So,
I've seen it really, really, really knock out Lyme.
oh, well,
Absolutely.
That's awesome. So this is what you do now, but in between, when you were still in the hospital, when you were still working, and you've been and done some of these trainings, you've been to Gerson and stuff. Didn't you say that you had a period where you were because there's a few stories I wouldn't mind this is knowing, because this is how it works. I think you were talking about you got reprimanded a few times at the hospital for taking the knowledge you've been learning and like putting it into practice. I think you mentioned a couple of different ones. One with a guy who had Chagas disease. Is it with parasites? And another one.
Oh yeah.
Yeah.
I got myself in trouble in the hospital quite a bit because I was wide awake and seeing, all the things they were doing in the hospital to really keep people in a chronic condition. There's no profit in health. There's no profit in death. There's profitability in a chronic illness where you keep coming back. So, this 21-year-old kid with Chagas disease, which is a parasite that usually is in Central and South America. And he was sick. I mean, he was addicted to opiates. He'd come in and get Dilaudid every single time, which is so addictive. And so I went in his room and shut the door and said, you really, really, really need to have parasite testing. You really need to do a gut cleanse. You really need to do this and that with your diet. And, where I get in trouble is I would write it in the chart. I would be so upset that no one had told this kid who's now an opiate addict that there's another route. Or, that this patient has been on this proton pump inhibitor, which is an acid blocker like Nexium or Prilosec, for, 2 years when the package insert says they should not be on it longer than 3 months. And I would write these things in the electronic medical record, in the chart. And so then the, head of the hospitalist would come and sit me down. You can't work for us anymore if you write that. The primary care doctor saw the chart, and they're the ones who wrote the prescription for 2 years. And so it's like everyone was covering, excuse my French, but everyone was covering everyone else's ass. And no one was worrying about what the correct and ethical thing to do was in these situations for these patients. They just say, Jessica, that we know the medical system's really messed up. So, I wanted to look them straight in the eyes and say, so you continue to perpetuate it.
Yeah. It's mad. It's madness. And this is something that we're talking about as well. And this is why I think it's weird, because we were talking about a little bit before where doctors, I think I talked about it with, I don't know if you know Terry Tillard, was talking about, he had a few friends, he works with people with cancer, and he's saying he's had a few doctors like yourself, even though they know what they're doing is wrong, or they know it's saying wrong, or there's better ways to do things, they're just afraid because they're on 400 or 300k a year, and to go and do something else, to take a third of that salary, it's a big decrease, right?
Yeah, absolutely. But at some point, these people have to, it's a little bit like selling your soul. At some point, you have to ask what is the right thing to do, because you're basing your decisions off a system of fiat money that was made up. It doesn't exist unless we play the game.
True.
And if in a different reality where money never exists, no one would ever worry about that.
Yeah,
and so although it's reality now, but I mean, they have to live with it. This system is dying. People are going to have to figure out another way. The doctors are frightened for sure.
Yeah, I think that's I mean, yourself, you still got the MD title, correct?
Yes.
Yeah, and
yes.
So have you not had run into any problems, or had friends take away or be sued or anything like that because you're now no?
No, not at all.
No, because you're you're holistic now, and you're prescribing holistic treatments, but you're still got that MD behind your name. I didn't know if it can, because I've heard talking to interviewing other doctors before. They said they've mentioned that people, obviously, if you start coming out with different theories, people can start discrediting you. They can it's sort of like career suicide.
I mean, it can be. I will tell you that I think in a different time and place, that would have been a big fear of mine. But I think that things have changed so much, and the system has been blown wide open and exposed so much that it's going to be really hard to discredit someone who wants to speak truth or look down different avenues. I mean, the patients are really fed up. I mean, they're really fed up. They want, everyone wants a different route.
Oh yeah.
I even think the doctors in the hospitals feel trapped.
Yeah, I think it's just, as you say, it's like them protecting. It's a capitalist society, right? It's just them protecting their products and their income.
Absolutely.
And so they'll do whatever they can to do that.
Yeah.
So it's quite interesting that no, well you're it's good. I mean it's very brave of you. I've got to say to do what you're doing. And it's just very good that no one's actually come out and well you're not even you might be on the radar of a few people, but as long as they're that's good. That's really good. So how do you if someone wanted to get in contact with you, Jessica, how would people do that? I mean, you got Skype consultations, etc.
Yes, I do. That's probably the biggest thing right now. I do my products, which I really put my heart and soul in and very passionate about. And then, on my website, there's a contact sheet. So, I get random questions from people. I get Skype consult requests. And I really try to answer all of them that I can in a reasonable amount of time anyway. Mm-hmm. So, yeah, that's the best way to get a hold of me. I try and be pretty accessible via social media and on my website.
No, awesome. And what's next in the pipeline for you?
What's next for me?
Yeah.
Hopefully, I would really love to be on the circuit speaking at certain events. And really, I would love to get some interviews. I'd love to continue podcasts and TV show interviews. Continue broadening my horizons as far as the supplement lines go and continue to create ethical and sustainable products for people just to show them there is a different way. So I'm hoping to get more into media. We will see, but I'd love to write a book in the near future.
Yeah. And yeah, I mean, I think that'd be good for your products. I'm just having a look on your website right now. People want to get them. What's your, you got Codon Master, Heavy Metal Master, Hormone Master, the oils. So the Coconut Master, the Ozone Master, is that they've all been treated with ozone therapy, correct?
Yes, absolutely.
Just lost you a little bit there.
Yeah. Oh, yes, I know. Can you hear me now?
Yeah, it's a little bit weaker, but it's all good. Yeah, go for it.
Okay. So you asked about the ozone?
Mm-hmm.
Yeah. So the ozone, absolutely, we actually work closely with longevity. So, those are always high-quality products that I really believe in. And we've come out with a bunch of different ozone products, actually. We have hemp, we have coconut, we have olive oil, and jojoba. So we have a lot now. Okay,
and what ones... What I'd say, if people were going to say, why would someone pick olive oil or jojoba or hemp? What one does what? Because this is something that I've started to recommend for some of my clients as well, just so because people are always interested in, and they'll be like, well, what one should I use? Just out of curiosity.
Right. So they're all very good. It just depends on what you like. Some people love olive oil. I love the coconut personally because you can oil pull with it.
Mm-hmm.
That's what's important. I love that you can put it in your mouth and swish it around, and you can use, even dentists now are using ozone. So I prefer coconut for that reason. Jojoba is closest to human skin, and so that is a very absorbable formula as well. But hemp is great. It holds the ozone probably the best. And I am all for incorporating more hemp into the world and what we use on a daily basis. I think hemp could actually save the world. So those are my top favorites, but one is not better than the other, I would say.
Oh, awesome. Okay. I'm just reading it out here. It says it's helpful in beating out viruses, treating acne, psoriasis, and eczema. And it also protects the Earth's atmosphere and our bodies, which is really, really good. Okay, Jessica, just for everyone listening, Jessica's actually got a hair appointment, and so that's why that's why the sound quality just dropped a little bit there, but she's actually going off. So she's really good to fit us in today and listen to her story. But thanks very much, Jessica, for taking the time out to speak to us today. Everyone jump on over to www.drjess.com, and there's also, you also work with another practice, is that correct? I think we just lost you there, Jess. You actually work for another practice as well. There's another website that you can be found on. What's that one?
Yes. So I work at, right now I work at Green Earth Medicine Clinic as a medical marijuana doctor, and we do cancer consults there. I also work at 2Be Well Clinic, and that is at 2bewell.net.
You're working with medical marijuana?
Ways you can reach me. Yeah, absolutely. 100%. Absolutely.
We might have to get you on a call again to talk about that. Because that's another thread that needs to be pulled. Okay, Jess, thank you very much. Sure. Yeah, thank you very much. I'll let you go because I know you're driving, etc. And I'll have a great day.
Yes. Thank you, Ryan, for having me on. Thank you so much, everyone.
No worries. Bye-bye, Jess.
Bye-bye.
So there we are, guys. That was Dr. Jessica Peatross, and what an amazing story. I hope, once again, it has just shown you that there are quite a few doctors these days even stepping out from their learning. I mean, Jessica went through a lot of medical training, 7 years in medical school, hundreds of thousands of dollars put into education, and even then she still couldn't say, you know what, I'm just going to carry on doing this. I mean, as she said there, it comes to sort of a moral compass got in the way. She wasn't seeing the results with her patients that she expected. Then she got ill herself and went through her own health issues, which happens to a lot of people in this industry. And it's then that you start searching for different answers. And although people talk about medical studies and etc., I always say medical studies after the 1950s, a lot of them are irrelevant because they've been bought and paid for by big pharma and carried out by scientists that are in their pocket. And you know what? I'm going to keep on saying this. It's going to be something that probably become one of my catchphrases. The truth is what works, and that can be different for different people. But in holistic terms, well, you might have one protocol, one principle that really works for you. But there are quite a lot of areas that everyone should be standing in terms of their health. There's obviously little nuances. Everyone has a few things different, but the mainstays of staying away from chemicals, eating organic food, having clean water, having enough sleep, exercising, getting daily sunlight, etc., etc., etc. These are all things, and hopefully Jessica's story there has explained a lot to you, and it's actually maybe it opened your mind a little bit more to someone who's actually been in that industry. For her, it must have been very, very difficult to step out of that industry. Taking a lot of, there's so many people who say it's about success as well. And it's the same with a lot of things. You've got to have staying power, you've got to have patience, and you've got to have belief in your ability, because otherwise you will just carry on towing the party line. And it's going to be very easy for Jessica to do that, carry on taking £300,000 to £400,000 a year, big house, it's living on the same street as a mayor. But for her to step away from that, because she knew what the truth was, takes a lot of courage. And hopefully, as you say, changes are coming slowly but surely, and hopefully we'll get a lot more information out to people like yourself, like listeners like yourself, to keep on giving you the confidence and the knowledge and the power to question things, to take your health into your own hands, and to really start living the life that you love and the life you want to live. Okay, guys? So next interview I've got lined up. I've actually got a couple lined up. So I don't know which one I'll be doing first. It may be all about glyphosate. It may be all about fluoride. It may be all about the power of the mind. I've got 3 powerful interviews lined up with 3 different experts, and I'm not sure which we're going to get on yet. So as soon as I know, you'll know. And as always, jump on over to www.reviveyourself.co and read all the articles we've got there if you're interested about health. Lots of videos there for you. And if you've got a health issue that you need or would like to talk to someone about, click on the contact, send me a message, I'll get back to you as soon as possible. And if you've got any gut issues, then don't be afraid to download my free Hidden Health Paradigm, that guide, and it'll be straight to your inbox as soon as you put in your email and your name, etc. It goes straight to you. It's a free guide that you can get. Also, be jumping on YouTube channel quite a lot, so look out for our Revive Yourself YouTube channel, where I'll be dropping a lot more in-depth videos about those topics. Otherwise, guys, as always, stay happy, stay healthy, and I'll speak to you soon.
If you're struggling with gut issues, such as gas, bloating, constipation, diarrhea, indigestion, heartburn, and want to finally be able to eat the foods you love without the crippling after effects, then don't forget to head over to reviveyourself.co and pick up your free copy of the Healing Health Paradigm today.